Good afternoon, my friends. Happy Wednesday. The doctor is in the house. Episode of To Your Health with Dr. G on this great day. I tell you what, today's show is going to be fierce. We're talking everything testosterone. That's right, fellas. Testosterone. Ladies, too. But this is going to be a great show. I'm so excited to keep this journey going on. Mark Gomez, welcome back. I'm a board-certified internal medicine physician practicing out of Edward Hospital in Naperville, Illinois. And I tell you what, today's topic is something that I wanted to talk about for a while. A number of months ago, we did a show for the ladies. We talked about something called paging the OBGYN. We talked hormones and a lot of other things at that time. And I encourage you to go back to my website, www.drmarkgomez.com, to check that out. But today, testosterone, we're going to be breaking down myths, facts, and other realities of this awesome hormone for the guys. Hey, I want you guys to do this. I want you to share the show today. Keep this message going on. I've got a great panel of experts today. My great friends, you're going to meet them in a few moments. We're going to be breaking it down. We want to set the record straight. Again, when it comes to things that we do on To Your Health with Dr. G, it's all about building trust and delivering truth. At the end of the day, we want you to all to be healthy. Men out there, ladies out there, anybody out there that's listening to us, we want you to have the tools for success, health. You're going to be more likely to have success in your life. So welcome back to another episode of To Your Health with Dr. G. We're here live on Facebook. We're here also in studio at Intellectual Radio. And we're going to have a great show today. So we're going to break down testosterone, but before we break it down, let me hit you with a quick disclaimer. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be at www.toyourhealthwithdrg.com/disclaimer. So here we are. Again, I've been wanting to do this show for quite some time. We want to set the record straight. I'm going to probably tell some personal stories of patients that have come in. But this hormone, testosterone, such a vital hormone. We're going to break it down. But again, for us as men out there, and really the show is for everybody. But the men, I want you to pay attention because really, the reality is that we want you to have success with your health. But there's so many things that are out there. Guys, we get inundated by testosterone advertisements, this theme of machismo. I mean, everybody's got to be like a bodybuilder or a baseball player, but we get inundated with information. But we want to set the record straight about testosterone. We have a couple great board-certified clinicians that deal with this issue on a daily basis and can advise our men. At the end of the day, again, we want you to have all sorts of good health. Everything like that. Hey, so let's do this. So let's get right into it. So for those of you that are new to the show, what I do each week is I interview my great friends and colleagues, experts in their field, at the top of their game, and we talk about a particular topic. Today, we're breaking down testosterone. So I want to introduce my guests, and you guys are I tell you what, my guests today, they are fierce. And I say that every week on the show because we only have fierce guests. So that way, everybody's still happy. But it's true. So, hey, welcome back again to the show. So let me introduce my guest today. My first guest today, he is awesome. I got to break it down. And let me read you his credentials because his credentials run deep. So I'm going to introduce my friend, Dr. Kyle Kiriluk. He's a board-certified urologist with Uro Partners. Check him out, www.uropartners.com. Dr. Kiriluk, welcome to the show.
Thanks so much for having me, Dr. G. It's I'm really looking forward to it all week long.
So. And I'm so excited. I got to tell a quick story how we know each other. Of course, I know your wife, Dr. Shivani Kiriluk, and she was on my show a few months ago breaking down the gut microbiome. So after we had an awesome show with her, and by the way, check out that episode. We broke down the gut microbiome with Dr. Kiriluk, his wife, and then after she and I connected here, you and I then connected. We had a great dinner together. We met our spouses and all that kind of stuff. And I go, hey, we got to have a show. And so I'm so happy to be here. So happy that you're here today. So let me ask you this. Where did you go to medical school? Let's break it down a little bit. Where did you go to medical school? Where did you do your residency? Maybe a few opening remarks about testosterone, things that you may hear in your daily practice.
Absolutely. So I went to medical school at Rush University in Chicago, and then residency at University of Chicago. Testosterone, kind of as you already alluded to, there's a lot of stuff out there and a lot of, I think, myths associated with it that for men, they kind of it's almost like a snake oil back in the Wild West in some ways in terms of what they say it can do and what expectations patients have, a fountain of youth, and that's not always the case. So
Excellent.
Yeah.
Well, I'm so excited. We're going to break this down and get a little more granular with you in a moment. But thank you again for coming out today. I want to introduce my next guest. He and I go way back to our days at Loyola University Medical Center. A longtime friend of mine, expert colleague as well too, and just a great human being and runs an awesome practice. So I want to introduce a good friend of mine. I'm going to read his credentials because I don't want to mess him up. His credentials run deep too. Again, everybody has great credentials. Here we go. My next guest, Dr. Hong Lee. He's a board certified endocrinologist, diabetes and endocrinology group. Check him out, www.drhonglee.com. Dr. Lee, welcome to the show.
Thank you. Thank you for having me.
Hey, Dr. Lee, tell us a little bit about yourself. Where did you go do your medical school? Where did you do your training and your fellowship? And also a few opening remarks about what this theme of testosterone means to you today.
Sure, sure. So I went to med school in Minnesota, U of Minnesota, and then afterward I get my internal med residency and the endocrine fellowship at Loyola. Okay, and now I'm practicing in Hinsdale area. So me being a endocrine clinic, so we see a lot of diabetic patient with thyroid, but in terms of hormone, like female hormone and male hormone, which is the low testosterone hypogonadism. That's the patient that we see, every day. And then actually, interestingly, because when we look back, we just look at the prescription of testosterone in the U.S. market from 2012 to 2019, it go up by fivefold.
Wow.
So let's just like you say, with the more media, coverage, more awareness. That's why it's something that we see a lot. So I'm glad you do this episode today.
All right. Well, thank you, Dr. Lee. And again, my thing today is really to kind of set the record straight. Again, we want you out there. We want you as listeners to the show to make the right decisions, but we want you to make informed decisions. At the end of the day, we want you to get your health information from trusted experts, licensed clinicians. I don't want you to get your health information from, I'm going to be honest, I'm just going to have real talk, but I don't want you to get your health information from some high school kid that works at the local health store. I want you guys to be invested in your health so you can make the right decisions for you and your well-being. But again, our job as docs is to make sure our patients have success. We give them the right tools for success. But part of that is making sure that we're telling the truth. Again, building trust, delivering truth is what we do on To Your Health with Dr. G. So now you guys have met my guests. It's so awesome. So what we do each week, you've met the guests. We break it down a little bit for you. Again, we're talking about everything testosterone, the myths, the facts, and other realities. So when people come to our office, we call that the chief complaint. The chief complaint, when somebody comes to your office, it's the reason why they're there for you, those of you who don't know. And so they tell their story. So today, the chief complaint, AKA the question of the hour is, I'll read it to you. Men are inundated with many testosterone advertisements that appeal to machismo. So what are the myths, facts, and other realities of this hormone? So we're going to start like this. Before we dive into this, I want to just ask each guys, because I ask this to all my docs that come to the show, just a general term. Let's ask this question. Just generally speaking, before we dive into this, let me ask you this question. So how do we create, I'm going to ask this to Dr. Kirlick, just generally speaking, how do we create urgency in health? How, we can't deny that we have health epidemics in this country. Just a quick kind of take on this. What do you think that we should be doing out there to improve health? Just kind of quick take. I ask this to all the docs.
It's a very challenging situation, and a lot of, especially men in general, they don't like to come in to see the doctor. We kind of ignore problems sometimes, and I routinely see it in more commonly not with testosterone so much, but someone with blood in their urine, and it's been going on for months, and they just say maybe it'll get better, maybe it'll get better. I think we just have to have open discussions whenever we can about the importance of coming in if you feel there's a problem, and we're here to help out. And it's not scary to see the doctor. A lot of times people are really afraid to come in, and it's usually a conversation more than anything else.
I love it. We got to have that conversation. We have to be open, and we have to know what we want to do. Dr. Lee, just a brief kind of opening remark on, just generally speaking, what should we be doing to live healthier lifestyles?
Live healthier lifestyle. Well, for me, I see a lot of patients who are like overweight, obese, or with type 2 diabetes. I think I will focus more on, we have to, really revisit what we eat. A lot of time I told them, just like you say, there's a healthcare urgency, like, forget about the norm, because what everyone in your house, at work, they eat, maybe everyone is not eating well. Your exercise intensity may not be enough. So forget about norm. You think about what really good. Sometimes Asian ask them, look back on the video show in the 70s, see what people eat, the amount and the choice. So that's how I kind of like encourage them to think outside the box. Think about, oh, everyone eats this way. Well, then everyone is not good. That's why, now in terms of diabetes and obesity is kind of like endemic in this country.
Yeah, I agree. For me, I tell my patients, I go, I break it down in 3 ways. I go, what do you want to do? Why do you want to do it? And how are we going to get there? And I think we have to have those kind of frank conversations and not be afraid as clinicians to talk to our patients on whatever health topic. Yes, we're going to be focused on testosterone. We're talking about testosterone today, but we want people to be comfortable. There's no such thing as crying wolf when it comes to your health. And I think every docs here today would agree, as Dr. Kirillick just mentioned, something's going on and it's been going on for longer than probably a few days or so. You might want to think about getting that checked out. On the flip side, some people will say, I don't want to run to the doctor for every single thing that's going on. But again, we want you to take ownership of your health because, again, you're going to take ownership of your life. So here we go. So testosterone, I like that. Thanks, guys, for a little opening commentary. Ask it to all the docs. So here we go. So down a little bit. Testosterone 101. So I'll ask this question to Dr. Kirillick. Just generally speaking, what is testosterone?
Well, it's viewed as the male hormone, so to speak, and it supports several important functions in the body. Sperm production and helps promote muscle growth and bone health. There's some controversial aspects about testosterone in terms of cognition and overall brain function, but I think we'll probably be getting into that in a little bit. Yeah.
Awesome. I always say, when I tell my guys, and again, we're talking about why do we seem to be inundated with information? We're getting into that kind of stuff because it's just there. But I always think like guys want to get like an edge. Guys want to have an advantage of some sort of life, and maybe this kind of advertised miracle, this miracle drug. Might be the answer to all that ails that person. And I think, in human curiosity always comes in because, hey, this might give me this edge. I'm looking to lose a little weight. I'm looking to gain a little muscle. I'm looking to be better in the bedroom. I'm looking for anything. I'm looking for cognition or whatever it's going to be. And so, guys, I think not every guy is gullible, but many of us guys may be gullible and start doing these kind of things and spending lots and lots of money. We can all tell stories of guys that have spent a lot of money on testosterone supplements out there and have gotten zero benefit from a clinical standpoint. On the flip side, maybe we've all had those cases where somebody might try something without consulting their physician first, and then they actually do have some benefits. So let me ask this question to Dr. Lee. Dr. Lee, generally speaking, where is testosterone made in the body?
It's making the testes of a guy.
Excellent. And so I always tell this to my guys out there, protect your nuts. And so at the end of the day, yes, we make those testosterone from our testes and the testicles, and certainly has so much to do with everything, male secondary sexual characteristics, the growth, as Dr. Kirillick talked about, and other things as well too. So I mean, testosterone we need it. We're just so inundated with so much information, but we want people to do it the right way. So let me ask you a follow-up question, Dr. Lee. Sure. We're talking about some of the many physiological effects of testosterone in adults, but again, we get inundated. So does everybody, in your opinion, do we all need to be bodybuilders? Do we all need to be baseball players or football players? Because it seems like that's what the advertisements are out there for. Hey, you could be a baseball player, a football player, just take this testosterone.
Yeah, I think maybe there's a commercial component of that, but I have to say, when I look at my patient, like for some patients, maybe they have more physical work, or they maybe in law enforcement or construction or fireman, maybe they have a different expectation in terms of like, how much strength or muscle I need, and they don't want to deteriorate, as opposed to many of us on the office work. So maybe kind of like also based on the background too. To me, that's how I see it. So
yeah, and again, I think this is where remember those days when guys used to. I mean, they're still doing it, but back in the days where guys would take a needle, an injection in the gluteus, in the butt, and then actually get these massive gains from doing this hormone. And there's no doubt that there's a lot of truth in that, but there are some potential perils when you're doing that kind of stuff. And we want people to get their information from docs. If they want to do something related to their health, I always say as an internist, I say, consult me, ask me. I may have an opinion, but I want people to have that conversation before they potentially get into some potential challenges. But there's no doubt that hormones are so powerful in the body, and that some of the gains that you can get are amazing. And again, everybody, I think for us guys out there, we're looking for that edge. And I'll be honest, I've seen some of those things as I'm reading through a magazine. I'm like, maybe my wife, Miss Tiffany, might want to see me a little more buffed up a little bit. And she's listening to the show right now, but maybe she wants to see me a little buffed up a little bit. Or do something like this, or I feel like I want to get a little more energy, a little more pep in myself. But I always say, you know what? Let's look at more the real causes. Maybe somebody has low energy because they're not getting good sleep. Maybe the diet's got to change. Maybe they're not doing what I always advocate, predominantly plant-based nutrition. Maybe there's unburdened stress because you're commuting an hour each day to the work and back. And so there's other things that you got to look at the play instead of just jumping right to the magic bullet, so to speak. What's your thoughts on that, Dr. Kiriluk?
Oh, absolutely. I mean, you're kind of going over the vague symptoms that people present with low testosterone, and all the time people come in and say, I'm tired. I think I have low T, and it's like, well, I'm tired too. I mean, who isn't tired? It's so it's something where the question is always, are the symptoms someone is experiencing, is it truly related to having low testosterone? And then if I'm going to do an evaluation, I always set the expectation that even if you have low testosterone and we correct it, you may still have the same exact symptoms. And it's kind of, we have to look at quality of life and how this is gonna help you.
Excellent. Dr. Lee, you want to expand on that? Essentially, that Dr. Kiriluk just said that you can correct certain things and then guys are still symptomatic. Can you give some more examples that you see in your clinical practice?
Sure. To follow what Dr. Kiriluk said, like there's a lot of symptoms. Some of them may be more like general that could be overlapped with, can be from hypogonadism, but also can be from other stuff, lack of sleep, anemia, or, hypothyroid, right? But, from us, from the endocrine standpoint, there's only 3 things is specific. When we see that, we say, yeah, more likely, quite sure is you're low in testosterone. So those 3 things, one is, if they have, like suddenly the testes get smaller.
Okay.
The second one is if there's a acute, as an adult, suddenly losing the body hair in the armpit and the groin area.
Okay.
And the third one is, if you look back the history, it seems like they never get complete puberty in terms of the body hair distribution or maybe the voice. They kind of almost look like kind of boyish. Those are the more specific ones. But other than that, there's, all the other things in terms of sex function, erection, libido, those can be like multifactorial, like you say.
Okay. It's interesting. I want to repeat what Dr. Lee just said. You mentioned smaller testicle size, loss of some body hair in your armpits. And then also you mentioned, what was the last one you mentioned?
So incomplete puberty.
Incomplete puberty. Okay. Very interesting. So again, again, I tell the guys out there that listen to the show, if you're feeling something's wrong, talk to your physician. I cannot understate that. I cannot state that even more clearly. We want people to come to us, whether you come to me as an internist, or you see Dr. Kiriluk as a urologist, or you see Dr. Lee as an endocrinologist. We want guys to go ahead and come forward with that information. Again, we want you to have your best life and your best health. But without having that initial conversation, we gotta talk about it. And again, I've had plenty of guys that come in my practice that have spent 6, 7, 8 months taking an over-the-counter testosterone sup from the local health food store, from the local high school kid that's selling the product, and they, to the tune of spending hundreds of dollars or $1,000. I had a guy just a few weeks ago that came in, had 6 months on a product that I'm not going to name, and he said it didn't. I go, why did you start taking this? Well, I'm having fatigue. I want to lose some body fats. I want to gain some muscle. And the guy's in his 50s. He's got obesity, and he's like, so I asked him straight up. I go, did you notice anything? Is your energy better? Did you shed some weight? And the answer was clearly no. And so I kind of said, I could have saved you hundreds of dollars, and we could have maybe just had this conversation and then start to work it up a bit. And so again, we want guys to go ahead and question. To Dr. Kiriluk. So Dr. Kiriluk, Dr. Lee mentioned low testosterone, also called hypogonadism. But I have to pick your brain on this one. So there's so many words to describe low testosterone. So I want to read you kind of this word soup of things. So here it is. I got it written down because I want to write it down. So the word soup of low testosterone, hypogonadism, androgen deficiency syndrome in the aging male, also called ADAM, andropause, or male menopause. Male menopause, late onset hypogonadism, male hypogonadism, or the newest one this day and age, testosterone deficiency syndrome. So let me ask you this question. Does it all really matter, how you name it? I mean, you got to call it, if a duck's a duck, it's a duck. If it quacks like a duck, walks like it's a duck. Does it matter when you're seeing patients, like how you phrase it? What do you just say? You say it's just, treat.
I think really the name doesn't matter so much, and maybe part of that's marketing, right? I mean, because the
male menopause.
Yeah, exactly. But it does come down to what is it truly from low testosterone, and if I correct that, will it truly help improve quality of life? And are there any health benefits to changing it? What what I'm interested to hear about too is just what is truly the definition of low testosterone. We don't even agree on a value for what normal ranges are at any particular age, and it's for all the money that's spent and all the time that's spent on it, the fact that we don't have that information is always been very interesting to me.
Dr. Lee, why don't you expand on that a little bit, because it's true. You might have patients coming in and say, hey, check my levels. Firstly, just check my levels, doc. And then you give them so say you do the test and it comes in at 300 or 500, or why can't we have any consensus on the matter? And how do you kind of approach that, where you see a lab and you're really trying to look at the patient as a whole and not necessarily focus on the lab?
I would say a lot of time, when they came to see me referred by the primary doctor, many of them maybe already have the initial workup, have a testosterone laboratory, like you say. Then I will make sure I look at the lab. I make sure it has to be due in the morning. And also the other thing is, ideally they were fasting overnight, because actually after someone eat, it can lower your testosterone, so the number can be foresee a bit low.
Okay.
So ideally we could, I will ask them, because testosterone release is kind of like diuresis, kind of like circadian rhythm. So I would say, if you can do it 2 hours after you get up, and if time allow you do it twice, then we'll get a good number. Yeah.
So you are a big advocate of repeating the test. So say like I, as a primary care doc, I ordered the test and it's low, and then I send them your way, or you're very much an advocate of making sure that they repeat the test.
If they could. And I have to say, if possible, I will try to get the one with both total and free testosterone in one combo.
Okay.
Because the free testosterone is really the soldier, the army, and the blood to do the function of testosterone. And then, but the total is the free combined with the reserve. So it's more accurate. We know the free. It's true that even with my organization, Endocrine Society, they recommend you can start with the total. But for me, I can see sometimes the total may be a bit off, but the free is okay, because some people may just have a bit lower reserve. So I would say we get both, then we get a better perspective.
So go ahead, Dr. Kierlich.
Part of the reason also for getting that second check has to do with insurance. If you don't have that second check, insurance may not cover it. It is quite expensive. There are some other clinics that may rely on just the one and charge you cash only.
Yes, we are very familiar with some of those clinics that are out there. They will remain nameless.
Yeah, absolutely. So I mean,
they know who they are.
Yeah, but if you if you truly have the diagnosis, it should be something that's consistent over time, and that's also part of the point of making sure that that's the case.
Excellent. It's interesting. I was at a conference not too long ago, and actually probably when I was trying to re-up my boards 2 years ago for internal medicine, and they did a lecture on testosterone, and they had guys come in that are considered now andrologists. And I thought that was very interesting. Again, going back to this word soup of different words, ways to describe low testosterone. But I thought it was very interesting because testosterone is legit. I mean, it's real stuff. And so we're presenting some data on the clinical implications of testosterone deficiency, or male menopause, or andropause, however we're going to call it. So things like insulin resistance and diabetes, inflammation, atherosclerosis, hardening those artery walls, hypertension, vascular stiffness. And so having a combination of high blood pressure, plaque buildup in those walls, with hardening of those walls as well too, that is risky. There's no doubt that is risky for heart attack, cardiovascular disease. So we don't want guys to be, kind of my take home message from that conference was, we don't want guys to be hanging out super low. Plus they might feel physiologically, they might have some physiological manifestations where they feel like crap, but there are some implications in having it low. Of course, we want to prevent diabetes. We know that according to the CDC guidelines, 80% of diabetes is preventable if we just have a healthy lifestyle. So it's 80% or 80% plus and 90% plus of cardiovascular disease preventable. We just don't do these kind of things. And so my point is that we want to take testosterone seriously. If a guy has low testosterone, we want to properly work that up and hopefully start some proper treatment. So let me ask this question to Dr. Lee, and we'll do a few more of these questions related to low testosterone. Then I want to kind of flip the thing. So say there's a guy out there and he has certain kind of I guess the question I'm trying to say is like, when should, guys are coming in, they're coming off the street saying, doc, scream me. Are there any particular patient profiles you're looking for when you're going to screen them for low testosterone? Is it like this patient with this diagnosis, this patient with this diagnosis, et cetera, et cetera? Is there like a typical patient based on their past medical history that should be screened?
Well, for screening, I would say yes. I would say in general, we won't recommend just broad screening because there's some studies show that even 30% of people who, I don't even call them patients, but 30% of men, they can have no symptom, but when you check it, the testosterone level can be a bit on the low range. But if you talk about who should be screened, I would say there's really a broad, but for sure, if someone have the symptom of fatigue, and then you have, those, we talk about the losing the body hair, and then combine maybe with a history of, some patient, if they have HIV that can cause that. And also if patient, with a history of like some head injury or like some cancer treatment or radiation, those may play a role. Yeah.
Okay. Dr. Kirlick, are you seeing any particular guys that you might see in your practice and you say, you know what, maybe we should be screened at all?
Oh, absolutely. What's a little more common for me is anyone that has fertility issues. That's really important to evaluate, and especially typically for that we'll also be getting semen analyses. If semen analyses are normal, then it kind of obviates a need for that, but also erectile dysfunction in general. And it's something where a lot of men, again, come in with erection problems thinking that they may have low testosterone. Sometimes they do, and that can be a help. But a lot of times, unfortunately, erectile dysfunction is a marker of other just cardiovascular illness. And it's important that they come in and have screening and also realize the cardiac implications behind that.
One of the first things, speaking of erectile dysfunction, one of the first things that I do if a guy comes in and sees me is before they get the little blue pill that's out there, I do a full cardiovascular workup. I found a number of patients that have failed an EKG or failed a stress test. And looking at the reason why you have erectile dysfunction is truly a vascular issue. And so before they can get the blue pill or any similar pill, they have to have a full clearance from a cardiac standpoint because it's dangerous. We're talking about, at the end of the day, heart disease wins out over erectile challenges. But let me ask you this question because how do you have that conversation of like with a guy? And maybe I'll ask this question to Dr. Lee first, and then Dr. Carroll, you can chime in. So say I have a guy. Say I'm a guy.
Mm-hmm.
I am a guy, but it's it is what it is. But say I'm a guy. I'm 35, 40 years old. I'm not thinking about 15 years from now. I'm just thinking about, hey, I'm here, I'm present, but maybe I have high blood pressure. Maybe I got pre-diabetes, maybe I'm diabetic. But how do you have that conversation with guys like in their 40s to say, hey, by the time you're 50, you actually may have erectile dysfunction? How do you even get that? That's not even on somebody's radar when they're in their 40s. And then of course you see the guys when they're coming to your office in their 50s and they may have erectile dysfunction. You trace back to history and find out, hey, there were some risk factors for this. Also, let's check your testosterone too. But how do you kind of have that conversation with to plant the seed with patients that may be at risk for erectile dysfunction?
I think me being a male physician, talking about this with guys, with men patient, usually is okay. As long as, I show that respect, I'm not making fun of them. I just brought it up like, so do you still have morning erection, or how's you and your partner, how is your libido, your sex drive, or how's your sex life? And then usually people are pretty open about it. Yeah, they may be a little bit more embarrassed if their spouse in the room too. But you get a good point. Sometimes we don't ask, we don't know. They don't brought up. They thought this may be part of the normal aging. But we brought up and say, yeah, now you're not that great. And can you imagine 10 years from now, or when you're 50, 55, you'll be worse. They may give them even more initiative to get their blood pressure better, get their lose the weight and stuff. Yeah.
Yeah, we had to talk lifestyle. What's your take on that one,
Well,
Dr. Gerlich?
well, absolutely. I think it's, and I don't have to deal with this as much as both of you, but struggling to help people control diabetes and high blood pressure, they don't see the initial effects of that. But for erections, that is oftentimes one of the first signs, and that can be, something that may hopefully motivates them to take control of the situation.
Excellent. Let me ask you this question, because there's some things, we're talking about some of the things here. Hey, guys, you're listening to us here. We're at Intellectual Radio Studios. You're listening to us live on Facebook. We're having this conversation about testosterone. We're talking a little bit about erections right now, and that's fine because we want to talk about this kind of stuff because a lot of guys have these kind of questions. We're talking about it in relation to low testosterone. So let me ask this question, and you kind of already, let me come back at you, Dr. Kirlick, just to be kind of clear. So say you are treating a guy that has low testosterone, you're treating him for erections, and things are not getting better. You treated the testosterone. Maybe you've had the level normalize, but the erections are still bad. What are some things that you're doing at that point to help the guy? If the guy's sole mission is to achieve an erection, what are some things that you're doing for that guy?
That's it's kind of an algorithm almost, right? I mean, you start with medications like the blue pill. If that doesn't work, there are injectable medications that everyone's a little bit nervous about, but they can work well. There are actual where you can implant an artificial device that works. Another thing, just in general, I always tell patients to be open with their partners. Sometimes troubles with erections aren't really a medical issue, but just daily stressors and anxiety, and those are things that if someone's open with their partner, it helps relieve the situation and it can improve things.
Okay, Dr. Lee, let me ask you this question. You mentioned earlier about some of the more specific symptoms. Guys that may have gone through incomplete puberty, guys that have smaller testicles, guys that have lost some body hair in the armpit region, or the pubic region, reduced shaving. We talked a little bit earlier. There are some less specific things. If fatigue is such a broad description, when people come into my office and they say, "Hey, I've got fatigue," of course, me as an internist, I'm thinking of every single possibility, and it may be hard to nail down in one visit. But a lot of guys will say, "Hey, I got fatigue." But are there also other kind of less specific things besides just fatigue or decreased libido or some erection challenges that might signal low testosterone in a guy?
Like other less specific.
Less specific symptoms, like maybe like sleep challenges, or Dr. Kirlick mentioned, controversial about concentration or mood or things like that.
Yeah, I would say, like from the, like, not that specific. I think, like you say, the sexual function, the ejaculation, and then maybe sometimes they complain about like harder to concentrate or brain fog, and those could be, yeah.
Okay, Dr. Gerlich, your take on that?
Yeah, I mean, I think that if I had someone that comes in and says, my partner feels that I'm not interested in them anymore, and it's a lack of libido that's affecting the relationship, that's always something to me that I'm worried about low testosterone.
So let me ask you the follow-up question, because I get this all the time. So say I've got the couple in the room, and they're saying, "I'm not interested in this relationship," and they say, "Doc, check my testosterone," and of course it comes back normal, because we've all been there where it comes back normal, and then they say, "Well, it's got to be testosterone. What's next?" And it's a hard challenge to go through, to say, like, why does a guy, you can't always explain why a guy's got decreased libido, or I mean, you want to try to explain it. Don't get me wrong, but sometimes you just can't. And maybe it is more of, maybe there's some other symptoms, like they have, maybe depression, or maybe there's some other kind of mood disorders that are going on there. So it's always kind of a challenge sometimes when you see that. Let me ask this question. Again, there's this thing that always comes up when I'm thinking about these ads. Again, we're inundated with things, and there's this ad that's on the radio. It says, "Guys, know your levels." So as a urologist, as an endocrinologist, me as an internist, does the level really matter? And actually, let's define this first. Maybe Dr. Lee, I'll give you this question. Is there a level that your society defines as low testosterone?
Yeah, I think there's a range,
Okay.
And the range will be, sometimes can be specific about the lab you use. There's a range. And then I would say if the lab was doing the right time, and patient really, like in the morning while after good sleep, and and it could be low. If it's low combined with symptom, then yeah, I would say yes, likely they have hypogonadism. Yeah.
What number? Just out of curiosity, what number do you define? Like, what number do you use for a cutoff?
I would again, I would look at the free testosterone more, and then I would say I forget the range right now.
I think the range is it's so funny. I was looking at it today
Yeah.
because I had a patient. I was looking at some labs,
Mhm.
and I thought from at least our lab, it was like 50 on the low end or 46 on the low end,
Mhm.
and up to about maybe 170 or so on the high on our free levels. And then on the total, 300 considered
To
low,
1200, I
up to
guess.
like 1200. That's just a gigantic range,
Yeah.
and it can mean completely different things for each person.
I use a cutoff of 300 for
Okay.
total. There are some societies that use 250.
Okay.
Mhm.
I find it easier to use just a higher. Everyone more is
Get my
more is
number
better.
higher,
Yeah,
Doc. Come
yeah,
on,
more is always better, right? So, I use 300, and it's interesting to hear your take on the free versus total, because it can be a little controversial in terms of how much that ratio matters, but certainly something that I'll consider going forward.
Yeah, thank you. So let me ask this question. So we're talking about certain get goals today. So some people would say, well, Doc, how do I get my testosterone up? And so I kind of think of it as a clinician, hey, obviously there's treatments out there. We think of like the FDA approved agents that are out there, the pharmacologic agents, let's be honest, and then of course some of the non-pharmacological. So I'm going to take the non-pharmacological approach, and I'm going to kind of pick your guys' brains on what you guys do from a pharmacological approach. So I think like again, so if a guy's out there, listen up, guys. Here we go. We're gonna break it down for you. So if a guy has, for example, sleep apnea, treat the sleep apnea. Because actually in some guidelines might call for guys with sleep apnea to be screened for testosterone. Exercise, weight loss, going back to the basics. I think that's an important thing that all of us should be doing, and maybe might have a benefit. Now, I can say that we can all probably say we've advised people to exercise, and they do a lot of stuff, and they still have low levels. Stress reduction, meditation, yoga. That's also a good thing out there for people to do, but we should be doing probably that stuff every way. Anyway, a couple of things I like to do. If guys are on opioids, actually, it's been shown that opioids can actually lower some testosterone levels. So we want to get them off of opioid therapy. Very interesting on that thing. It's something that I learned relatively recently at a conference, and I thought it was quite interesting. But we know there's an opioid epidemic going on, and so you want to see the effect of that on testosterone levels. And then I think like the last thing I'll probably say is just getting back to like return to normal sleep. I can't underestimate the importance of sleep. It helps the body recharge. When you're sleeping, you make some growth hormone. Naturally, you feel better. Hopefully you're waking up with some nice serotonin levels, this feeling of well-being, and you have some pleasurability and some dopamine, and maybe all that kind of leads to you feeling better and maybe helping that testosterone grow. So let me ask this question to Dr. Kierlich. What are the kind of pharmacological agents from your end, I'll say from a urologist end, and then maybe Dr. Lee from an endocrinologist end on what you guys are doing?
So like what I'll use for replacements. So the standard one that I start with, just because it's easy, is a topical gel. There are implants essentially that you can place in the skin and release. It's like a time release over time. There's like an injectable that's a long-lasting injection, and then there's more traditional injections that are given every 2 to 4 weeks, depending on the situation. I have patients that have had all those products, and there's kind of pluses and minuses to everything, but it really does start to come down to patient preference in some way, in my experience.
Dr. Lee, do you find yourself doing some of the same techniques, same approaches?
Yeah, I would say the gel and the weekly injection, the one that I use the most often. I think, for me, for the older population, 50 or above, they may like gel. They don't have to poke themselves. The gel is good in terms of, it's very steady. Like you do apply it every day, and then it will just stay in the system, like steady. For the shot, the good thing about the shot is earlier, Dr. Carrick talked about sometimes insurance approval would be a bit harder. So for the injection, if we talk with the patient lab, everything confirmed that they are hypogonadism. Sometimes even if the insurance don't cover, for pay out pocket for the injection is still actually quite affordable. So that one, I will have them do, every week, sometimes, they may even do like lower dose, but every 3 days, so there'll be less of the peak and trolley. Yeah.
Okay.
They do recently approve a pill.
Oh.
If they approve a pill, you do it twice a day. But that pill is not for everyone. But they like, especially because this pill can increase the risk for high blood pressure. So they even have a black box warning. It may increase the risk for like stroke and TIA. So that one is mainly for patients who really have like structural problem, like Klinefelter and the testicle, or some problem in the brain cannot release the stimulating hormone. So that's for those.
You're interesting. You mentioned like, there's no such thing as free lunch, as the saying goes. And yeah, if you overshoot some targets, or guys are taking some stuff, on the street or whatever, or they're taking some of these subs that might be available without a prescription, you can potentially have there are some complications of supraphysiologic, so above the physiologic goals of testosterone. You mentioned high blood pressure, cholesterol, we're seeing that, liver disease. You can see a lot of different things that are going on there, mood issues, insomnia. And so a lot of things can go on that, again, the high school kid at your local health store is not telling you that kind of stuff. And so again, we want you to get your information from your doc, because I think we have to be honest with our patients and tell them all the risks. Again, there's no such thing as free lunch, but we want to, certainly our hallmark of treatment is to make guys feel better and continue to have success in their health. Yeah.
I think that, I have a lot of patients that, again, they see the visual results,
the muscle mass, baby,
but external appearances do not equate to healthier insides.
I
like that.
And it's something that, people think they're healthier, but in fact, they may be having risks because of the use of testosterone, and it is important to know that.
Dr. Lee, any other kind of side effects or things that you may see if the targets are overshot, or people that are coming in off the street and seeing you in their practice, but they may have some symptoms of maybe higher levels of testosterone than they ought to have?
I think in general, like the testosterone, it can promote bone marrow to make more red blood cells. So some people can have a higher amount of blood in the system, which could be, when the blood is more viscous, increase the risk for blood clot and stroke too. So even though the risk is relatively low, but those are stuff we explain to them. And some of my patients, maybe I even recommend them to do therapeutic phlebotomy, or like blood donation, to lower the blood count. So
excellent. Well, hey, I want to do this, guys. We've been having this awesome conversation. I got to get into my myths versus facts section. Sure. For those that are new to the show, and those, of course, that have been following the show for a long time, we do something every week called myths versus facts, setting the record straight. So here we go. Myths versus facts that testosterone shows. So what I'm going to do is I'm going to say a statement, and I'm going to have my panelists say myth or fact. We're going to kind of keep it kind of boom, 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 keep this going on. And there are right answers. There are opinions, of course. But again, we want you at the end of the day, even though we're going to do this, I want you at the end of the day to talk to your doc. You're hearing some stuff from us, but talk to your doc. So here we go. Myth or fact? Dr. Kierlich, you get the first statement. I'll say the statement. You say myth or fact and tell us why in a few sentences. Here we go. If your doctor diagnoses you with obesity, metabolic syndrome, or diabetes, then the root cause is low testosterone.
I would have to go myth with that one, and I would say it's actually the exact opposite. That more likely your diabetes is the cause of low testosterone. We know that if you're overweight, if you have extra fatty tissue, the fat actually creates estrogen, and then the estrogen blocks testosterone from being produced in the body.
I agree. Here we go. Next one. Here we go. Dr. Lee, here's a statement. Low testosterone is undertreated and underdiagnosed. Myth or fact?
Can I say depends?
Yes, you can. Hey, it's your opinion.
It depends.
It's a show, but it's your opinion. It's all good.
Studies did show that in the last decade, actually, there's more awareness. But lately, there's there's some articles say that there's a concern of actually underdiagnosed because now there's the media not media, I should say. Actually, there's sometimes some reports say that there may be a negative effect on the cardiac health. So sometimes it kind of like draw us, the provider, to offer the patient, so it may be undiagnosed sometimes.
Yeah, I would agree. As an internist, we want to keep people treated, and certainly some of the studies that have been out there associating low testosterone with a whole host of increased risk for other metabolic issues or physical diagnoses. So I agree with you. All right, here's a statement, Dr. Kierlich. Low testosterone is a normal part of aging.
We don't know, I would say. I mean, it's something that, again, we don't know normal levels across age ranges. And, I think that many men will have levels that stay normal as they age, but we do expect some decrease over time. And whether you say that's normal, I don't know, but yeah.
I agree. Wonderful. Here we go. Dr. Lee, here's a statement. Low testosterone can be linked to mood swings, fatigue, low energy, and a lack of drive to get up and do things. Myth or fact?
I think it's a fact, but also other condition can cause those symptoms too.
All right. Thank you. Here we go. Dr. Kirlick. There are no harms in taking over-the-counter supplemental testosterone formulations. Myth or fact?
I would say that's an absolute myth.
Please explain.
Well, the best example I can give, and it's not necessarily for testosterone, but people all the time are into supplements, and it's I want to take a supplement rather than a prescription, and they're both pills, right? Why would you? But vitamin E, right? You look at vitamin E, and so many people that take that, and studies that show excess vitamin E causes heart disease, and so a lot of times we're putting things in our body that haven't been thoroughly looked at, and who knows what's in the supplement that you're getting, and there may be risks that we're completely unaware of with it.
There's like a nice comic book strip, and I might be butchering it a little bit, but there's two lines. There's like two stands, and there's like a receptionist or somebody in a stand, and there's two lines, and the one line says drugs and pills, and it's got a full line of people and surgeries, and then the line that says lifestyle changes, and there's 0 people in that line. And so it's so true. All right, here we go. Dr. Lee, we'll do a couple more of these things. This is awesome. Here we go. Some active steps to prevent erectile dysfunction include exercising regularly, keeping a healthy weight, avoiding smoking or vaping, and taking care of other problems, including diabetes, heart disease, and kidney disease. Myth or fact?
Yeah, absolutely, it's fact. Yeah.
Please explain.
Because we talk about hypogonadism, low testosterone. Some of them is functional, secondary to some chronic condition. So in those patients, if they can losing weight, they can get more sleep. Those actually will help help the testosterone level and the function more than the replacement. So.
All right, here we go. Dr. Kirlick, I think we answered this question already, but I'm saying it again. Here we go. Every adult male should know their testosterone levels. I hear on the commercials all the time. Myth or fact?
I think every adult male should know their cholesterol levels and their blood pressure levels.
Excellent.
And not their testosterone.
I like
levels,
that. I like that, and it's good. As an internist, that makes me feel nice and warm and fuzzy. Knowing that my specialty colleagues say that kind of stuff. Yeah, I have no idea what mine is. I'm actually due for my labs. I actually did have it though, everybody. I just got to go get my labs done. It's happening very soon, I promise, I think. All right, here we go. A couple more of these things. Here we go, Dr. Lee. Testosterone replacement therapy may or may not improve erectile dysfunction. Myth or fact?
It's a fact. Yeah, I mean, for your erectile dysfunction, many things may play a role to it, like the blood flow, nerve problem, or psychological or hormonal. So if it's related to the hormonal, then the testosterone replacement, may help it.
All right, thank you. Here we go. Dr. Kirlick, we'll do 2 more of these, one for Dr. Kirlick and one for Dr. Lee. Here we go. Dr. Kirlick, testosterone replacement therapy will cause prostate cancer. Myth or fact?
That's a myth, although maybe a little controversial, but I truly feel that testosterone is not the cause of cancer. I would describe it as the fuel that can feed cancer cells. And so the question from a prostate cancer standpoint is, well, how much do they need to be activated? And, even if you have a little bit there, we find that cancer cells can be activated in patients in prostate cancer in advanced states.
All right, thank you. Here's the last one, myths versus facts. I've saved this one for Dr. Lee. I thought of you when I wrote this one on purpose. Here we go. Testosterone excess will cause road rage, fighting among fathers at Little League games, and sexual promiscuity. Myth or fact?
I think road rage and fighting among father may play a role, but a lot of stuff there's a component of the the culture, society and stuff,
Yeah, I think there's other issues at play on this one, but I say testosterone excess should not cause fights to break out at Little League soccer games or baseball games. So there you have it, everybody. Myth versus fact. So hey, we got about 5 minutes left. We've been having this awesome show talking about testosterone, breaking down some of the myths, breaking down some of the facts, and certainly breaking down other realities related to this. So at the beginning of the show, I talked about the chief complaint. At the end, we call it the assessment and plan. The assessment and plan is when somebody leaves your office, they have a diagnosis, they have a game plan, and most importantly, a follow-up. So let me ask this question to Dr. Lee first. Dr. Lee, just give us a few take-home points. People have been listening to our show today. What are some take-home points that they should have from today's show about testosterone? How can we keep this conversation going on?
I think, sexual health is very important for men and also for like a relation. So I think if they think that something may be related, don't hesitate to discuss with your physician. But also, patients should have open mind that, the symptom maybe also can be from something else, not related to just testosterone level.
Excellent. Dr. Lee, it's been awesome having you on my show today. Thank you very much for taking time out of your schedule to help me out.
Thank you.
All right, Dr. Kiriluk, take us home a little bit. Give me a few take-home points out there. People have been listening to our show, learning about testosterone, all this kind of stuff that we're doing. And but just what are some messages for people out there, the men out there that are listening to us? What should they take away from the show? How can they be successful related to testosterone and their health?
Absolutely. So, I think that it has to do with kind of goals of care to some degree. And I look at testosterone as something that it may, if it brings you in and I can get it better and you feel better, that's great. But we also should consider, again, overall health and what is this doing to make me a healthier individual, to protect me potentially from future heart problems. Will use of it cause heart problems? And it's a very controversial area. It's not right for everyone to have replacement, but certainly worth the discussion if you're concerned about it.
Thank you, Dr. Kiriluk. It's been a pleasure having you on my show. And my final words are this: guys, listen up. I love talking to guys, of course. I love talking to everybody. But guys, I want you to take your health seriously. And I know many, many of you do, because many of you are my patients or patients of Dr. Kiriluk or Dr. Lee. We know that people want to do better with their health. Sometimes we have to have these kind of conversations. But we want people to have these conversations. That's the most important thing. We're talking about testosterone. Yes, we need it. We exude it. We need it to thrive. But we want to make sure it's done in a safe way. We want to make sure that you have proper testing, but really coming back to your lifestyle. Things that make you feel good, things that give you vitality and strength and energy to do the things that you want to do with your family and your loved ones. That's really our broader mission. And I don't want you to lose sight of that. So again, I want to thank my guests today, Dr. Hong Lee. Let me read his credentials again. This has been an awesome show. Dr. Hong Lee, board certified endocrinologist, diabetes and endocrinology group. Check him out, www.drhonglee.com. Thank you, Dr. Lee. My good friend, Dr. Kyle Kiriluk, board certified urologist at UroPartners. Check him out, www.uropartners.com. Hey, you've been listening and watching live on Facebook and IntellectualRadio.com. This episode is written by Mark D. Gomez, MD, and Tiffany E.R. Gomez. Producer is Tiffany E.R. Gomez. Music is by the wonderful Mr. Havis. Copyright 2019 by MDG Wellness, LLC. All rights reserved. Hey, stay tuned for my next episode. I'll be back in 2 weeks. We're going to be talking about the best sleep ever. And remember, if you like this show, share with others. This is the only way to get the message out. We want people to take action on their health. I want you to feel great. And check this out, guys. I'll see you in a couple of weeks. Have a great day. Check out my website, www.drmarkgomez.com. And peace out. Peace. Muscles.